Knock on the door. I'm gonna walk in. I'm gonna wash my hands. Hi, my name is Grace and I'm going to be your nurse today. Today we are going to be doing a wound dressing change. I provided privacy. The bed is in the low and locked position. Call light isn't within reach and non-skid footwear is present. Can you please state your name and date of birth?
Maddie Jacobson, 9/13/05.
All right, and if there was a bracelet on the patient, I would check that as well. I have my equipment. What is your pain right now?
Probably a 4.
Okay, all right. I'll check the provider order. What else? And I'm able to teach the patient, if possible, about I'm able to answer any questions that the patient has regarding the wound dressing change. But that should be it before. Do you have any questions for me?
No.
Okay. I'm gonna make sure you're decent. Then I'm going to wash my hands and apply non-sterile gloves. Oh, these are small. Oh, they don't have any. Okay. Thanks for doing some gloves. Oh my gosh. All right. I'm going to loosen the edges of the previous wound dressing with the push and pull method. Right, and discard this the gauze that was previously in it. And by the looks of it, it is a beefy red color. I'm not seeing any signs of drainage, but the skin around it is looking a little irritated. I'm going to measure the wound. I'm going to stick this in the deepest part of the wound to see how deep it is. Please let me know if you feel any discomfort, but this should take just a second. All right, then we are looking at about 3 centimeters deep. Then I'm gonna throw this away. And I'm going to measure the length of it. We are 8. Let's see. 9. About like 13.5 centimeters long. And about 2.5 centimeters for a width. Going to change my gloves to hand hygiene. Going to get my supplies ready to clean the wound. I'm going to get my sterile gauze and soak it in some normal saline. I'm gonna have to grab different gloves. Alright, now I'm going to take a singular piece of the gauze soaked in saline, and I'm going to bring the corners in. And I'm going to start at the top and go in the inside and make my way down to clean the inside. And discard of that. And then I'm going to squeeze the excess out to the corners. And then I'm going to do the side. Discard of that. And then do the other side. And then outside. And then the final swipe on the left side. And there was some excess saline, so I'm going to wipe that up. Alright, and then that is all for the cleaning portion. I'm going to discard my gloves and do hand hygiene. And then I do need an abdominal pad. Going to get another set of gloves. Oh, okay. I'm going to grab a glove. I do need to do my tape. And I'll do my hand hygiene again. And put my gloves on. Alright, and I'm going to take my gauze pads and roll them up, put them in the wound to pack it. To roll it and stick it in there. This may hurt a little bit. And right now the patient does not need any medication because they said their pain was a 4, but I will come back and check in a little bit to see if they need any more. Everything is packed in. And then I'm going to take the abdominal pad and place it with the blue line up. And put it right here. Make sure it covers it correctly, and then I'm going to put the tape on in the window pane method. Make sure it's secure. And I'm going to this one. Alright, that is completely covered now, so I'm going to throw away my used supplies and take off my gloves. Then I'm going to put my initials on it with the date and the time. B, G, J, 3, 10, 26, and it is 12:50 p.m. And then I'm going to make sure that the patient is still comfortable, and I'm going to come back a little bit and see how they're doing, but otherwise that should be it, and we should be all done. And then I'm going to document if there's any drainage, what it looked like, if the color, and if there was any pain during it as well. But that should be it.